Hey everybody, welcome back to AskMeDoctor Weekly Q&A. I am Hazel from motherhood.com.my. Today we will speak to Dr. Cheng, Obstetrician and Gynaecologist from Tung Shin Hospital, Kuala Lumpur. We will answer top 10 questions that you submitted earlier on Facebook and Instagram. Hi Dr. Tan, how are you?
Hi everyone, my name is Dr. Tan and I'm from Tung Shin Hospital.
Alright, let's get right into our question today. How long should a couple try to conceive naturally before they seek for infertility treatment? We have friends that have tried for 4 years, 5 years, even 7 years.
Okay, normally what we say that if women of reproductive age and if they have not conceived after 1 year of unprotected sexual intercourse, we will term this as infertility. One thing you have to bear in mind is, let's say that the couple is having regular sexual intercourse, the lady is less than 40 years of age, and 80% of them actually will conceive within the first year. Now the remaining 50% of them will conceive during the second year, which means that 90% of the couples will conceive within 2 years times of trying. So what we normally say is give it 1 to 2 years. If you really don't conceive within that first 2 years, then yes, please come and have a check and see whether there's any causes that is causing infertility.
Now that also leads to the next question, which is how do you diagnose whether a man or woman is infertile?
Okay, for men it's very easy. For men, generally speaking, all you need is a sperm test. Now before you have a sperm test done, what we will advise to avoid any sexual intercourse for the 2 to 3 days prior to that. And that's all. With the sperm test, we can tell that whether the sperm is normal, whether the man is fertile. Now for women per se, it comes in. There will be a few tests. Now the first test is a series of hormones tests to see whether the lady is ovulating. Now in female, every month they'll have a menses. Supposedly, if the menses is regular, by right you are ovulating every month. But if the menses is not regular, it is likely that you are not ovulating every month, and that may be the cause of you having trouble of getting pregnant. So the first test is to see whether you are ovulating. The second test is to see whether the tube is functioning. If a lady is ovulating monthly, but if both fallopian tube, which is connecting from the ovary to the uterus, is not functioning, that means the eggs will not reach inside the womb and she won't get pregnant.
So can it be done in one session of consultation?
Yes and no. In terms of the infertility testing for women, it comes in 2 different stages. The first test is actually to test whether the lady is ovulating or not. Normally this is done via blood test, and it's a blood test done at 2 different settings. One normally during day 2 of menses, one normally during day 21 of menses. Now this is looking at the variation of the hormone to see whether she's ovulating. The second part is actually the imaging study to look at the function of the fallopian tube to see whether the tube is patent or not. This can be done by hysterosalpingogram, which is known as HSG, and this normally is carried out in the radiology department.
If a man exercises regularly, is healthily and able to eject, he might be also infertile, right? Because you can only tell when he do the sperm test.
Yes, you are right. So if someone is ejaculating, we do not know whether there is enough sperm inside. So when you do a sperm test, there's a few things we look at. Number 1 is the sperm concentration, the total sperm numbers, how much of the semen volume is, and also we look at the motility of the sperm, like how much the sperm is moving around, the vitality of the sperm, how many of the sperms are alive, and also the shape of the sperm, which is the morphology of the sperm.
So then, is there any common treatment for infertility?
The treatment for infertility actually depends on the causes. Now, let's look at the data for the causes. 25% of the infertility is actually unexplained. That means all the investigation came back as normal. 25% is also due to the ovulatory disorder, which means that the lady is not ovulating properly. 20% is due to tubal damage, that means the fallopian tube is not functioning properly. 30% is due to the male factor, which means that the man is the cause of the infertility. Now the remaining 10% is due to other disorders such as the uterine or peritoneal disorder. All add up together, about 40% of disorders are found in both the men and also in the women.
So these are the common causes.
So based on the causes, then we treat accordingly. If the sperm is the issue, we look at the parameter of the sperm. Is it just a little bit abnormal or completely no sperm at all? If the seminal fluid analysis found that there is actually no sperm at all, then you have to find out why is that cause. Is there any tuber blockage? Or maybe is the genetic profile of the man is normal? Based on that, then we discuss further down to that. If it's just a minimal dysfunction, let's say that if the sperm parameter is just a little bit out in the normal range, there are supplements that can help to improve the parameters of the sperm. Coming to the ladies, if the main issue is ovulation disorder, that means the lady is not ovulating normally, we do have medications to help the lady to ovulate on time. We can do frequent scan and calculate when she is likely to ovulate, and then we can tell them when is the best time to have sexual intercourse. Now, if the tube is the problem, let's say both tube is not functioning, then unfortunately there's nothing much we can do but to go for the assisted reproductive technology such as IVF to help them to achieve the pregnancy.
Okay, so that's why there are too many causes, different causes and different treatments based on the cause of infertility. That's why it's very important that we have this session and more women, men and women have more knowledge about this. We are going to end our interview. For our last questions, if women go through chemotherapy and radiation because of cancer, will it lead to infertility?
Yes, actually we know that there are a lot of chemotherapy agents and radiotherapy that actually can be gonadotoxic. Gonadotoxic, that means that it is harmful to the eggs, harmful to the sperm. So, for example, if someone is taking alkylating agent in chemotherapy such as cyclophosphamide, so for sure the cyclophosphamide has been well documented as causing reduction in the ovarian reserve. Other agents also such as methotrexate, 5-fluorouracils, these are all the common chemotherapy drugs. It can also lead to the high incidence of amenorrhea, which is no menses thereafter. So normally for those who require chemotherapy or radiotherapy, the doctors will tend to discuss about the fertility desire, whether they want to have any more children after this. There are options to cryopreserve, freeze the eggs, freeze the ovarian tissue, or if you already have a partner, have a husband, you can choose to freeze the embryo for a later usage after completion of the chemo or radiotherapy.
Right.
But you have to understand that this facility is not widely available in every hospital. Only the bigger hospital will have this type of facility.
Is it true that too much masturbating can cause less sperm count and indirectly causes infertility?
But the masturbation leading infertility is actually a myth, and there are data that actually shows that we can achieve optimal semen quality, the sperm quality, if you have 2 to 3 days of no ejaculation. So it's actually not a correct statement.
Is it true that a woman can not do heavy work and extreme sport because it may dislocate the womb?
Not for the dislocation of the womb, but for extreme athlete, for example, gymnastics. Extreme athlete is possible to have irregular menses or no menses at all. This is known as athletic amenorrhea. So when the athletes eats a bit too little and exercise too intensively, the body will actually go into a starvation mode. And once your body is in the starvation mode, this will disrupt the production of the hormones, and therefore it will disrupt your menstrual cycle and makes it difficult to get pregnant.
Okay, so it might disrupt, but it doesn't mean that this woman will be infertile.
Now, as soon as you don't exercise too much, you started eating more, your body has enough nutrients, and the reproductive hormone starts to kick back in again, then everything should go back to normal.
Thank you Get-Doc and Dr. Tan for answering our questions today. Sign up Get-Doc Plus so that you can make your appointment before a consultation with Dr. Tan. Stay tuned for our next weekly Q&A. And remember to submit your question before Thursday and stand a chance to win free 2 years of subscription for Get-Doc Plus and also 10 ringgit motherhood.com.my voucher. See you next week! To learn more about pregnancy nutrition, tips for breastfeeding and delivery procedure, check out Motherhood Parent Craft online.